Mr. Speaker. I think it's helpful to measure these proposed changes against the road safety priorities that were set out in the Safer Journeys document, because that document very helpfully laid out areas of high and medium concern and also the areas for continued focus on emerging issues. Helpful because there's just an infinite number of road safety initiatives that could be implemented, and they were certainly amongst the thousands of submissions received, and it's simply not possible to do all of them. The areas of high concern identified were reducing alcohol and drug-impaired driving, increasing the safety of our young driving, safer roads and roadsides, safer speeds, and increasing the safety of motorcycling. And they're all either addressed in this bill or implemented in previous actions by the Minister, for example, the mandatory headlight use on motorcycles and the drug driver laws that we recently passed. But I want to talk about the first two of those high concern issues. That's the reduction in drug and alcohol impaired driving and the safety of our young. And in respect of alcohol, I think it's a bit of a shame that this debate's been dominated by the government's strategy of gathering more data on the impact of reducing the blood alcohol limit to 0.05, because in this area there really are a number of very good and meaningful clauses in the bill around alcohol impairment, lowering the legal youth drink drive limit from 0.03 to 0, zero drink drive limits for recidivist drink drivers, and the interlock issue, I think, are all very, very effective. And the Labour Transport spokesman challenges a member of the National Party to guarantee that the driving at 80 would be just as safe as driving at 50. Well, that's not going to happen. And the reason it's not going to happen is that we just don't know. The data does not exist to support it. So the gathering of the data... No, there's no data that says that a person driving at a 0.05 will cause an accident and that accident will cause impairment. The data has never been collected in this country. So it makes very good sense. And I find it ironic that the member, Ms. Fenton, is quite happy to ask our youth for evidence that increasing the driving age from 15 to 16 should be supported by good evidence before we do it, but no such requirement on the really, really bigger issue, I think, of reducing the blood alcohol level. Well, we'll hear about that in Select Committee, I'm absolutely sure, but the data does not exist. And actually what I think is the real issue that needs to be addressed, and some of these things will address, is that despite all of that, an unacceptably high number of drivers continue to exceed the 0.08 level. Last year, I think there were about 36,000 people convicted of driving over that limit. 36,000. So on the basis that, I guess despite the best efforts of our law enforcement, they won't be catching every single person who currently drives over the existing level, we've probably got several 100,000 drink driving events on our roads every year. So while I support the collection of data on the 0.05, 0.8 issue, I very strongly commend the policies and the police's effort to reduce that shameful statistic. And the issue of zero blood alcohol levels and interlocks for recidivists and the youth zero blood alcohol level is certainly going to improve that statistic. And I didn't want to get into a political debate on this issue while we are going to get widespread support, but I'm afraid Mr Hughes opened the door when, in response to an interjection questioning why Labour didn't lower the blood alcohol limit in the 9 years they were in charge, he said that there was a bill introduced by the previous government and the road toll had reduced under Labour. Well, I'm afraid that is simply not borne out by the statistics, which show that in 2002 the 12-month road toll was 404, and in 2009 it was 406. It went up, it went down, it went up again, but it's basically slid sideways since the turn of the millennium. And if you measure that in terms of deaths per vehicle kilometres, we have very poor statistics, and they are also flat. declining slightly but not nearly as well as they are in other countries around the world. 82% higher death rate per kilometre than the United Kingdom, 60% higher than Ireland, and 40% higher than Australia over that period. So it is simply not true to say that the initiatives of the past government were having the sufficient effect, and everybody agrees, even Labor, that this is necessary. So despite all of that, it is good Labor in the vast majority, perhaps a unanimous support of members, I'm not sure what the Greens are doing, will support the bill. And it'll provide a refreshing change, I think, for the Transport and Industrial Relations Select Committee to work perhaps a little more collegially over the next few months than they will be on industrial relations legislation, and I look forward to that. Commend the bill.